Good evening. I'm Sergeant Tom Letras with the Stanislaus County Sheriff's Department. This is your daily update for Monday, April 6, 2020. Our numbers for today are 81 positive, 1,666 negative, and still 0 deaths here in Stanislaus County. In the update tonight, I want to talk a little bit about some of the terms we commonly hear, such as quarantine, isolation, and stay at home. So I want to explain a little bit about quarantine. You are not under a quarantine order. I see a lot on social media of people saying they are quarantined. You did see quarantine early on. We had some cruise ships that were docked off of California, and a lot of the passengers on there had to be quarantined for 14 days because they were exposed to COVID-19. So quarantine really comes into play if you know or reasonably believe that you were in contact with somebody who may have had COVID-19. What we want you to do is we want you to try to quarantine yourself in your home for 14 days. That means avoid trying to get out for anything if you possibly can. If you can have somebody deliver your groceries, your prescriptions, or whatever you may need, that's what we are asking, but it's not a mandate. Now, isolation is a little bit different because isolation focuses more on people who are symptomatic. So you could have someone living in your home that develops some of the symptoms. That's the fever, the body chills, the aches, that is living with you. Now, with those symptomatic people, they're not necessarily going to need to be hospitalized. The only people that are being hospitalized are people that need advanced medical treatment because they've developed some respiratory distress. They may have difficulty breathing. But with an isolation, if somebody in your family has some of these symptoms, you want to try to keep them isolated from other members of the family. That means if you can keep them in a separate room, that's great. If you have more than one bathroom in your home, try to keep that person having their own bathroom so that you're not having other people use the same bathroom as someone who is symptomatic. So isolation is more of if you've either been diagnosed with it or if you're having some of the symptoms, you want to stay away from others. Now, the stay-at-home order is just that. That's for all of the rest of us to make sure we are staying at home as much as we possibly can. Now, even within your family units, if you can have some distance from each other in your homes, that's great. The reality is living together, touching the same items, if one person is exposed, you will all at least be exposed to COVID-19. It doesn't mean that you will get COVID-19. So I just wanted to clarify a few of those things. We get a lot of questions on that. Now, moving on to our community forum for this week. I know there was some confusion because I had announced that we were going to be doing our daily updates at 6. But for our community forum, we still want to do them at 5:30. So this coming Wednesday, April 8th, it will be live at 5:30 p.m. Now, we've already confirmed that Sheriff Jeff Dirksey and Dr. Julie Washampayam will be on our forum panel. We're currently trying to confirm a third guest. We've been listening to your questions, and we know we have a lot of stuff in behavioral health as well as small business and unemployment. So we are working on having a guest that can cover some of these questions and answer some of these serious questions that many of you have. But stay tuned. We should announce who that is tomorrow. And lastly, before I sign off tonight, one of the things I want to say is a big thank you to each and every one of you who are doing your part. I know our numbers are still going up, but I see them going up much slower than other areas. And so what that tells me is that more people are following the guidelines, are staying at home. I think we can still get better. I think we can still work more. But thank you to all of you who are staying at home. And before I log off, a real special thank you to all those people who are still going to work in essential jobs and providing us with the necessary supplies. Our truck drivers, our grocery store workers, our doctors, our nurses, our firemen, people who are working in response to COVID. We're very grateful for all that you do. So thank you all, and we will see you again tomorrow night.